Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Many seniors and people with disabilities require long-term care facilities, and their families want to ensure their loved ones are receiving quality care. The patients are particularly at risk for COVID-19, given their health status. I am pleased to have Leza Coleman, Executive Director of the California Long-Term Care Ombudsman Association, join me. Ms. Coleman began as a field long-term care ombudsman in 2006, assisting patients in facilities in Elk Grove and South Sacramento. Thank you so much, Les, for joining me today.
I am honored to be able to be a part of this and very grateful for the opportunity to share information about the Long-Term Care Ombudsman program and how it can be of value to your constituents.
Well, thank you. So what is a long-term care ombudsman and what do they do?
Isn't that a funny one? The word ombudsman is a Swedish word. It means to be an advocate, and that's really what the Long-Term Care Ombudsman program is about. It's an old program. It was first made federal by Richard Nixon. He felt that every resident of a skilled nursing facility should have the right to have access to a free advocate. And in California, the legislature decided that kind of advocacy should be available to residents in residential care facilities for the elderly, more commonly known as assisted living facilities, and also 6 beds, board and care. Those all fall under the same category. So the ombudsman is there to respond to complaints, concerns, requests for assistance from residents and their family members or the responsible representative. We focus on quality of care and quality of life issues. The ombudsman work for the satisfaction of the resident. One of the things that I talk about fairly often, so people understand kind of the focus that an ombudsman has, we call it expressed wish advocacy as opposed to best interest advocacy. I don't want to offend you, sir, because you're a doctor, and doctors and nurses and families and children often want what's in the best interest of these residents. But an ombudsman comes from the perspective of, what's the resident want? Mm-hmm. Just because I'm 85 or frail doesn't mean that my voice shouldn't count. So we do focus on the satisfaction of the resident. I should be very clear. I'm not advocating that a person who has advanced dementia who wants the car keys that we give them or encourage people to give them that. We're not being ridiculous here, but we are acknowledging that adults have a certain amount of autonomy, and I know personally I don't always do everything that's in my best interest, but that's part of living. Sometimes it's a little messy, a little long-winded, but that's really what an ombudsman is about. They are walking Google for all the rules and regulations of long-term care facilities so that the resident doesn't have to know all those things. They can turn to someone else and say, okay, this is what I want. How can I have this, or can I have this?
Mm-hmm. Well, as a walking Google, what kind of training does an ombudsman receive to be able to serve in this function?
It is a significant amount of training. Just to begin, you have 36 hours of classroom and online training, and then you enter into a period of supervised training in the field, and then there's a probation period afterwards. Until just very recently, it took more hours of training to become a certified ombudsman than to actually be an owner or an administrator of a residential care facility for the elderly. Only recently were the licensing requirements increased. So these are highly trained individuals. And in addition to that initial training, they have to commit, and they have to continuing education units. So every month there's an additional hour of training, sometimes 2 hours of training.
And many of them are volunteers, correct?
Yes. The program's base, the idea of it was that it really, as walking Googles, we weren't going to be doing the work for people. We were providing them with the information, kind of empowering the resident to do for themselves, empowering family members to advocate for the residents. And so for the longest time, the largest part of the team were volunteers. That has decreased over the years as we have fewer and fewer older adults in these facilities that can actually advocate for themselves. They really do need someone to assist them in resolving these complaints. And also we have a growing number of residents who don't have family members or people that can help them, step up for them. So ombudsmen are having to do a little bit more of it. So over the years, the number of volunteers has declined, and COVID-19 has not helped us in that. In January, we had about 700 certified ombudsmen, and at least 70% of those individuals are over the age of 65 or are in the at-risk category. So I'm working very hard with the local ombudsman programs as we start to envision what's this going to look like moving forward. So the program may have to change. I think everyone's embracing change, and the ombudsmen are nimble ninjas. I refer to them fondly. We will figure it out.
Okay. So what kind of concerns are residents reporting to the ombudsman, particularly during the COVID-19 pandemic?
Yes. I think the overarching concern is the lack of visits, a lack of human connection. Family members are calling the Ombudsman program with really growing, and as the weeks go on, heightened anxiety over not being able to see their loved ones. So many family members, or I shouldn't say so many, because we do know that more than half of our residents don't have someone that visits them regularly. But for those residents that do have regular visitors, those family members did a lot of the everyday care work. So family members and residents are concerned, they're not getting those extra services anymore because there's just not the staff available for those things. The social isolation, that's a growing concern. Care fees in these facilities are based on services that are provided. So right now, the facilities are bringing meals to residents. They're not having the residents, walk the hall to come to a congregate meal, or even just walking down the hall in a home. So we have some real growing concerns about, who's going to pay for those care fees if when all of this, when we go back to normal, will these residents have the physical strength and ability to walk to the dining hall unassisted? What long-term care, what long-term emotional impacts are we going to have from being isolated for so long? So families are growing quite concerned about the long-term ramifications of isolating in their rooms, the lack of physical activities, the lack of socialization even amongst the cohort that's staying there. We're getting a lot of calls from families that, we hear in the news that COVID impacts older adults and those that are in congregate settings at a higher rate. So there's just a lot of anxiety about, will I know if COVID is in the facility where my mom is? Will they be moving COVID-positive people into the building? We're getting more and more of those kinds of calls.
Now, if a resident or their family member has a concern, how do they contact a long-term care ombudsman?
Well, we have 35 ombudsman programs all across the state. And the easiest way, because I know podcasts could spread far and wide. So I can give you the phone number for the Sacramento region. That's easy. That would be 916-376-8910. And that's the Sacramento Long-Term Care Ombudsman Program, and it covers the Sacramento and the eight surrounding counties. If you go to the California Department of Aging's website, they have links for program and services, and there's a link for the long-term care ombudsman, and that sends you to another link that has a list of all of the programs based on county. So if the family knows what county the facility is in, they can find the ombudsman program that provides the oversight as far as the advocacy assistance for that particular facility. And then there is a crisis line that is available statewide. That is 800-231-4024.
Okay, that's great. And hopefully those numbers will be useful to people who have needs and need to reach ombudsman. Now, when the ombudsman receives a concern or a complaint, how do they handle that?
Well, it is important to remember we work for the resident. So even if it's a family member that calls or a staff person at the facility, we check in with what does the resident want. Because while a concern may be important to son or daughter, it may not be, because it may not be something that the resident wants us to do anything about. So I just preface that. Our goal is the satisfaction of the resident. So we're going to reach out to the resident, and we're counting on our long-standing relationships with facilities to help ombudsmen get to those residents. Right now, ombudsmen aren't allowed into the facilities, and so we have to use the tablets and the phones and standing outside of windows just like everybody else to do our best to communicate with the residents. We honor their wishes. If they wish to remain anonymous, then that's a part of this process. I have to say that right now, especially with COVID and especially not being in facilities, this is a challenge because it's very difficult to try and do advocacy when you're not in the building. So I would say that the efforts that we're doing right now it's a value. It's valuable because the people need to be heard, and they need to know that there's somebody that's doing something on their behalf, because sometimes that's all the person wants. They just want someone to know. They want to be validated that this isn't right. But without us being in the building, it is hard to make sure that the fixes that we're proposing or that the staff agree to are continued, that it's truly an ongoing fix, if that makes sense.
And you sort of touched on the impact the pandemic has had on ombudsmen, for example, saying that they can't actually go in the facility. Now, we're probably going to have to live with COVID for a while. It's going to be at least 18 months, if not longer, for a vaccine. We still haven't identified a treatment. We are lifting some of the stay-at-home orders somewhat as we're implementing other public health measures like testing, tracing, and isolation. How do you see the ombudsman program sort of evolving to meet the challenges of COVID-19 and the requirements that we were putting in place to protect not only public health, but particularly the residents in these facilities who are among the most vulnerable to COVID-19?
Yes. This is certainly creativity. There has to be some sensitivity and some rules that we're all following, and also some common sense to how we're going to advocate for folks. I mean, some of it has gone over the top, I would say. In Los Angeles, parts of Los Angeles, they've instituted such severe restrictions that families can't even enter the parking lot, so that they're not even allowing for window conversations. I think the lesson that we're learning from this moving forward is that the local ombudsmen need to do more work during non-crisis, non-pandemic times to create better relationships with the local public health, with the local Office of Emergency Services, so that there's better communication, that that the Ombudsman is included earlier, and the needs of these very vulnerable residents is included in the conversation earlier when we're creating a public policy. The Ombudsman programs, we're trying to figure out how are we going to secure PPE for our Ombudsman, and what's that going to look like? A family, they'll visit one facility. Staff may work in 2 facilities, but an Ombudsman could visit 5 facilities in a day. So we are so very conscious and aware of not wanting to track the virus from facility to facility, and so we are really looking at what equipment are we going to need, what protocols are we going to need, what tools. We're talking about perhaps getting tablets that have their own hotspots, so an Ombudsman could go to a facility and hand a tablet with a hands-free device to a staff person and say, could you bring this in and set that up in front of the resident so that the Ombudsman who's outside of the building can have a conversation with the resident, and then when it's done, pick that tablet up, clean it, and we're just going to have to be creative. We're going to have to figure it out. I can't speak for all of the Ombudsman programs, but I know many of them are very anxious to get back into these buildings and to see what is going on. Not that I believe facility staff are sinister. I believe that good quality care comes from living in these facilities. So it's really more about how can we as advocates be in the buildings assisting residents, assisting family members. I want the family members to have a sense of peace. They picked that facility for their loved one, or that older adult chose the facility for a reason, for very valid reasons. And those reasons and the need for services, that doesn't go away just because we have a pandemic. So I want people to remember why their loved one or why they chose to go into the facility, and that those are valid reasons.
Mm-hmm. No, that's so very important. And certainly we probably should think about various technological solutions that would allow the Ombudsman and the residents to connect, and also to allow the Ombudsman to safely assess the situation in the facility. But also technology has its limitations. So while we can talk about technological solutions, we should also be thinking about other types of approaches. And you mentioned PPE, whether there's a way for Ombudsman, maybe they can't go and visit 5 facilities in one day, but is there some way that they can still safely visit facilities and be able to do a eyes-on assessment of what's going on?
Absolutely. Ombudsmen are in the process right now of really, they know their buildings. They know the buildings that were having troubles before the pandemic, so they are pretty clued in onto who's more likely to be having staffing issues now. And so you're right. We would not, there's just no way we would be going into 5 buildings anymore. That's just not going to happen. And so they are, the local programs are identifying where do they need to focus their resources and how do they focus those resources. I absolutely encourage your audience. Now is the time to be flooding these facilities with resources, making sure that they do have the appropriate supplies and equipment. And at the same time, we will continue to hold them accountable for quality care. And so it's not a one or the other.
Mm-hmm. Now, given the experiences of the Ombudsman, what are some of the questions residents and their families should be asking of their facilities, or issues they should bring up with their facilities to ensure the health and safety of the residents and their loved ones in a facility?
Absolutely. So I kind of hit on that just a second ago with we really do need to flood them with resources. Mm-hmm. When you're calling your the facility that cares for your loved one, I would be asking, do you have enough PPE? Do you have enough toilet paper? we want to make sure that those facilities have everything they need. Are there tablets in the building that allow for the use of technology so residents can remain in communication with their families? Is there enough Wi-Fi in the building? You know, I'm not proposing that facilities relinquish their responsibility to provide those services, but I'm also recognizing sometimes they're so in the middle of it that they're not always thinking about everything. Mm-hmm. Families should be calling, but we should be sensitive. Your phone call is multiplied by everybody else's family. You know, so it's not just that the staff are being pulled away to answer your questions; they're being pulled away to answer every other family's question. And yet, I want to be very clear that if any of your listeners feel like when they call, they're made to feel like they're a bother, or they're made to feel bad about wanting to know, you know, is my mom eating? Is my mom getting up and getting dressed? What activities is my mom, you know, what activities is she participating in? Mm-hmm. Those are very valid concerns, and facility staff need to provide families with that information. And if you feel like you're not getting that information, or if you're being made to feel like you are a bother, I encourage your listeners to reach out to their Ombudsman program. We all are stressed, and we may have to give each other a little bit of grace, so we don't always respond in every moment at our very best. Mm-hmm. However, you should not feel like your request is a bother. I would encourage families to think about creating, if they don't already participate, or to, you know, if the facility doesn't already have a family council. A family council is a very valuable tool. It's a collection of the families that can communicate information. The licensing DAP does require that if COVID is in the building, if someone tests positive, that the facility has to notify the families. So a family council is a really positive way for families to share information I would say in a positive way, figuring out what can they do to help the facility. Now is not a time to be ganging up on administrators. But I do think family councils is something I would encourage people to participate in, and if they don't know about it, they can reach out to their ombudsman.
Wonderful. And finally, I know that many people are concerned about the safety of their loved ones in a long-term care facility, and residents themselves may have concerns for their own safety given COVID-19. I think there's a lot of fear and anxiety about this pandemic for good reason. Do you have any final suggestions in terms of how can we ensure the safety of the residents in these facilities?
That is the million-dollar question. And I know all the local counties, public health, are trying to figure that out so that we can all go back to normal faster. Mm-hmm. I would encourage people, family members, I know it is hard, but we have to follow the rules. I was hearing of some Mother's Day, fiascos, truly. Facilities have family members sneaking into buildings so that they could see their loved ones, family members not wanting to wear the mask, family members not wanting to stay in the designated areas, not following the timelines for visiting. So all of those things just create more anxiety, more stress. It doesn't help the situation. This is just going to take time. I believe that facilities have the knowledge on how to do proper infection control. The testing is going to come. There's some legislation that's being bantered about requiring all facilities be tested, both residents and staff, and likely that's going to be an ongoing process. But I would caution families from getting too excited about that. My husband did the test, and he said it was very uncomfortable. I think we might have some real challenges asking some of our frail older adults or those with dementia to willingly have a Q-tip, scratching their brain pan. So I think my message to families would be have confidence in the facility. You picked it for a reason. Your gut told you it was a good one. The staff there are still trying to do their best. Yes, there's a higher risk when older adults are in a congregate setting. There's also risk if you were to take them home right now. And I don't think families are prepared. I guess my message, sir, would be wash your hands, wear the mask, don't touch your face, make the phone calls, write letters, good mental health.
No, that's great advice. And just because we have to physically distance and do things to prevent the spread of this disease doesn't mean we can't connect with people. Certainly, I think your suggestion about families getting together and working together is very important. Getting the technological capacity in the nursing homes that would allow the residents to better be able to connect with their family members through technology and also with others as well, including the Ombudsman, I think is going to be very important as well as we try to navigate COVID-19. And certainly I think these solutions will have long-term benefit as well for residents. So thank you so very much, Les, for joining me today and sharing with our listeners about the long-term care ombudsman program, because I think it's such an important program for residents in our long-term care facilities.
It is truly my pleasure. I love talking about the ombudsman program. I always say to folks, very few people know what an ombudsman is, but the day after you discover you needed one, you're always impressed with all the things they can do.
That's fantastic. Well, thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. Together we are slowing the spread of the disease and saving lives. Thank you so much for listening.